Okay, came across this article, Yahoo Finance, and new proposal to lower Medicare age to 50 could be a lifeline to millions. Okay, so a group of Democratic senators have reintroduced legislation in Congress to lower the qualifying age for Medicare from 65 to 50. Um, Senator here from Wisconsin, Tammy Baldwin. When it comes to providing affordable health care for every American, there is more we must do right now to change status quo, improve our healthcare system, and lower the cost. Um, and Senator from Ohio. These are basically all Democrats. These are all Democrats, of course. Lowering said lowering the age limit could be life changing for millions of Americans. I remember a few years ago, I was at a town hall meeting at Youngstown, Ohio, and a woman stood up and said, "I'm 63 years old. My goal in life is to live till I'm 65 so I can get on Medicare." She was so focused on healthcare. She had two jobs at the time, both low wage jobs, and neither provided insurance. She just knew how important it was to have insurance to get on something that is popular and important and sufficient and as effective as Medicare. Let's see. So what would the changes effectively be if this law were to go into? And I don't think this is Senator Sanders because this is a bit more expansive. More than a quarter of Americans approaching retirement have little or no confidence they'll be able to afford health insurance over the next year. And 45% have little to no confidence they'll be able to afford the cost of health insurance once they retire. Right now, 60-year-old with annual income of $51,000, which is a little more than four times the poverty level, would have to pay a premium of $4,420 a year for a silver health plan on the Obamacare exchanges. That's the marketplace. If Medicare drops if Medicare age drops, that 4,420 annual expense would plummet or even disappear once the person enrolled in Medicare, depending on their care requirements. Okay, as I mean, they really didn't give me any details, so I guess they're just basically saying sounds like a one-liner bill where they're like, we're just going to drop the eligibility rate for Medicare from currently 65 to 50, and that's it. No other changes will be made, which should be a lot more. But as people approach retirement, their healthcare needs tend to go up. Little people choose to buy into letting people choose to buy into Medicare starting at 50 will fix that. It's something achievable. We can get done right away and make a difference in millions of American lives. Funny part about this article is then they have another column here or another section that says, but it doesn't have universal support. It's really crazy. Because then they go on to say most Americans support expanding Medicare coverage. A 2019 Kaiser Family Foundation poll indicates that 77% of respondents, 85% of Democrats, and 69% of Republicans support the idea of introducing a Medicare buy-in for people as young as 50. Okay, again, but it doesn't have universal support. I mean, for goodness sakes, over two-thirds of Republicans and nearly all Democrats, that's nearly universal support. That's actually higher than I expected it to be. And then, but they were really talking about it. But the idea faces detractors in Congress, and not just from Republicans. More conservative Democrats are likely to push back on any changes to the state-sponsored health system. In response to the comparatively modest proposed changes, hospital communities argued that expanded healthcare could encourage more people to retire younger, which would negatively impact the workforce. They're also concerned it will reduce the amount of healthcare providers reduce the amount healthcare providers receive in reimbursement. See, that's really the actual issue here. Congress is divided on this, or basically, it's not universally supported by Congress, and there's Yahoo Finance, man. I mean, for goodness sakes, you're just covering up the nitty gritty of this all. Yeah, the main reason is because it's really the providers, it's the hospitals. And really, any hospital, the medical providers, they're the ones that fund a lot of Congress through campaign donations. And they don't like the concept. The crap about retiring younger, possibly, actually, what may end up happening is people will just probably like probably do things that they want to do. Yeah, might be retire younger, or it could be that they just want to start a business. Also, what's wrong with someone in their later ages, leaving the workforce and letting someone else come in? I don't see a problem with that whatsoever. Instead of having people hold on to positions till dear end because they can't afford to retire because they can't afford healthcare expenses. So that's what I mean. That necessarily isn't a bad thing in and of itself. But yeah, this is the reimbursements. Congress is bought and paid for, and healthcare providers, primarily like the AHA, American Hospital Association, they don't want lower reimbursement rates. They much rather have people on, preferably employer-based insurance, because that's where they get the highest reimbursement rates. It's commercial insurance, so yeah, they much rather have you on the marketplace or basically private insurance. And when they do the buy-in, I mean, I hate that no article ever points this out, that there are still costs, and there is still a private sector aspect of Medicare. It's just Medicare covers so much that the private sector is much, like, the premiums are much cheaper, and they have Medicare Advantage to go through, which is fully privatized and funded by the government. So it's not like people go in Medicare as a single payer system. It's not a single payer. I mean, it's a majority payer, if anything. That's pretty much it. So I I mean, I don't think there's anything, wrong with that. Actually, I wouldn't mind it at all. Um, for people to have the option to buy in, I think they should just, yeah, get in an election period to either buy in or and then go on Medicare, and they'll probably get a supplement, and then they'll be eligible for Part D or Medicare Advantage, which most people probably would actually prefer. But there is a premium associated with Medicare, so some people may be better off on the exchanges based on their income. So I mean, but yeah, I mean, that would be a competitive option there. So I don't think there's anything wrong with that whatsoever. But I just, yeah, basically what this article was saying, that Americans want one thing, Congress doesn't want another. And Congress is basically saying, yeah, we don't really give a shit. Our donors from the hospital providers and the medical providers are basically saying, no, we don't want to do that because we don't basically want to take even, and think about it. You could probably, the exchanges will be probably cheaper because you have younger people on the exchanges, be more affordable people on the exchanges. You'll have probably a higher amount of people that will be insured. So, basically the hospitals, you would assume, be like, oh, well, this should be pretty good because we're probably going to have more people that we use our medical services, and we will actually get reimbursed instead of basically billing someone who can't afford it and not receiving, and basically it will be a lower amount of uncompensated care. So you would think it'd be a one-off for everyone, but at the end of the day, it's about the almighty dollar. So that's what it all comes down to. That's exactly why Congress, it's only 21 senators, I think, now at this point that would even partially support it. And honestly, yeah, it has no chance in hell. And that's mainly because they will get a lot of pushback from the healthcare community. That's exactly it.